HMN presents Harari Professionals, a program dedicated to raise awareness and inspire our youth by introducing them to successful Harari individuals.
السلام عليكم ورحمة الله وبركاته. أوركو تزيد كدرخو HMN حجاج سينا قدر زال سلامة سينا يبورد أخو كل سائلنا أوجي لي زالين برنامج بح نتلام دخو برنامج زو تبان وأسور إبراهيم عبد الحفيظ.
Assalamu alaikum, everyone, and welcome to another episode on Harari Professionals, where we aim to connect our youth to successful individuals like Dr. Amir. As always, we hope you follow along and learn some important lessons, especially if you're considering becoming a doctor. Dr. Amir, it's a pleasure having you.
Thank you very much. And assalamu alaikum, everyone. My name is Dr. Amir Ibrahim. I'm a general surgeon, currently working at Lake Rich Health, Beaumont Hospital.
Perfect. That's nice to hear. Can you just describe what you do from a day-to-day perspective? Like, just tell us more about yourself.
Thank you. So briefly, for those who don't know me, I'm originally from Ethiopia. I'm Harari. After I finished my high school, I got scholarship and went to the former Soviet Union, currently Ukraine, where I finished my medical school there. Later on, to make it short, I went back to Ethiopia, was working for about 5 years as a general practitioner in Asala Hospital. There was a mandatory return of service, and I worked there for about 5 years. Then I joined Black Lion Hospital general surgery residency, and I was there for about a year. Then I moved to Canada, specifically Toronto, in October 2001. Like all of my other friends, in order to get into the Canadian system, you had to do certain exams, and I have to meet some certain qualifications. And once I completed that, I did join University of Toronto in 2005. The first year was basically returning back to a medical school, and I did a clerkship for 1 year. Of course, this was the requirement. And then I did my residency in general surgery on the same University of Toronto. As I said, I'm currently working as a general surgeon.
Perfect. Can you just describe to the audience, what is the typical day-to-day life of a general surgeon? I assume it's more of an on-call basis, unlike general practitioner. Maybe if you can explain the differences between, general practitioner versus general surgeon.
Thank you. When you work as a family physician or a general practitioner, most of your work is the office-based, and you schedule your time, and depending on, the way you want to run your office, you may limit yourself to the office, or you can at the same time work in a hospital or you can take other responsibilities, but most of the time you do not have on-call responsibilities if you are especially working in the office environment. But when it comes to a general surgery, even though we are running our office, but we are affiliated to the hospitals where and you have to do calls. The way this works is you'll be given a privilege to work in a hospital to do your surgeries. So, obviously, as a surgeon, you do surgeries after you've seen your patients in the office. But the hospital also expects you to cover emergencies, and that's where the on-call life of the general surgeons. Most of our times are mostly in the hospital, and majority of the time goes to the on-call. For example, I am physically in office twice a week, but almost, unless I'm not on call, even including the weekends, I will be in the hospital, either seeing my patients, following my patients, or do on calls. Briefly, to give you an idea, expect to work at least about 100 hours a week, because depending on how many people are in the environment you are working, how many people could cover the call, you may be busy. For example, where I'm working is a small hospital, and technically only 3 surgeons who will cover the call, and that makes our call more frequent, as opposed to if you are, let's say, working in a bigger hospital. But regardless, expect to work, longer weekdays, week hours.
Perfect. Yeah, that's very good contrast between general practitioner and general surgeon. I guess one more question on this topic is, I assume there are specializations of surgeons. Like I would assume maybe there's cardiac surgeons and maybe brain surgeons and the likes. What is the difference between what a general surgeon does versus when you would need these specializations within surgery, if that makes sense?
Yeah, that's a good question. Those are considered subspecialties. As you mentioned, one can, after finishing your general surgery course, some of them actually right away from the beginning, such as neurosurgery, urology, thoracic surgery, just to mention few, those are just directly you go to those kind of residencies. But as a general surgery, there are also some areas where you first finish your general surgery residency, and then you do what we call a year or 2 of fellowships, like in colorectal surgery or minimally invasive surgeries. Those are just a new branch that are starting, but in reality, as general surgeons, depending on where you are working and whether the hospital you are working has access to other subspecialties, you may expand your practice. For example, even though, as a general surgeon, I'm still, I could still be able to do minimally invasive surgeries, or other name for it is laparoscopic surgeries. I do colorectal surgeries for cancer cases, including what the general surgery mostly focused on is doing, like gallbladder, hernias, or other, minor surgeries included.
I see, that makes sense. So more of the things that are a little general and minimal you would do, but then as soon as something's more severe from a patient, you would say, okay, they would now need a specific dedicated surgeon on that field to handle it.
Yeah.
Okay, perfect. I guess my next question would be, what inspired you to become a doctor? So you did explain your journey, getting your medical degree from Ukraine, former Soviet Union, and then coming here again and doing, renewing your medical, or even upgrading your medical, degree. But what inspired you to become in the first place? Why did you want to pursue it and then follow up? Is there something behind it? Is there some motivation that you'd like to, let others know?
in a way, back home, the way the education system was also the way you choose your specialty. Mostly, it is chosen for you by someone you trust or someone who you think knows you. For example, either the family or most of the time your teacher will tell you which direction to go, because or back home in Ethiopia, when you finish the high school, we have the high school leaving exams. It's called ESLCE. It's a long name for it, but the short of it is when you finish a high school, there will be national exam which everybody has to take, and where you go next will depend on what result you get there. And once you see that result, and you have the choice you take. If you are, lucky, you may get them, or you have a good result, you may get what your first choice is. Otherwise, you may end up having your second, third choice, and then. But in my case, because this was scholarship, I got what I applied for, and I could be able to finish my medical school abroad. So to answer your question, yes, somebody will choose it for you, but you will also will decide whether you want what somebody chose for you or not. But the inspiration part of it came as I joined the medical school.
I see what you're saying. So it's like more of, initially it was like you can become a doctor, you become this and you become that. And then you went into the doctor's field and suddenly you're like, wow, this is something amazing, something I want to, see through. So as you went, you actually enjoyed it even more.
Yeah.
Which is, that's interesting, because I've heard others say the contrary. So initially they have this huge passion and ambition for medical, but then after it begins, start questioning it, But it's good to hear that you had the other effect, where you really wanted to. I guess the follow-up question would be, what makes you passionate about this job? So you mentioned you got inspiration through it, but now you've already graduated. You're a medical doctor now, and you're, I assume, really happy with your job now. Practicing it. So like, what makes you passionate about it? Is it the fact that you are helping others, like, or is it because I would assume it's very it's not like a very calm job, relaxed job, if you get what I mean. It's more of like, as you said, on call and hectic. So I assume there's something else that's making passion that wants you to keep it, right? Can you just explain that? What's the passion that's keeping you motivated at the moment to continue working on that?
Thank you. Yeah. In my case, I will tell you how I came to choose surgery. After I graduated and start to work in a hospital, if you would have asked me right away after my, immediately when I started my practice, I would have said, I'm more inclined to do internal medicine as opposed to surgery. But then what I realized was while I was working, again, this is true for Ethiopia, as a general surgeon, because I have the practice of, the training of the GP, I could still treat the patients if, I need the skill of internist. Because the resources are limited there, and the way you treat them are pretty much the same whether you go to the internist or not. But one thing that the internist could not do is, in case of emergency, if someone comes with the, expecting mother, if she comes with the labor that requires immediate surgery, you don't have that skill. The second thing is actually first then I went to more interested on obstetrics, which is dealing with labor and delivery and emergencies with the females. I was practicing with the gynecologist in the hospital that I was working. And then again, I realized that I could do this part now if I'm forced, if no one is around me. But then I said, what's next if someone comes with the surgical problem that the gynecologist will not deal with it? But back home, the surgeons can do the surgery that the gynecologist does in case of emergency. But eventually, that's how I ended up choosing and, being passionate about the surgery. I would say briefly, it's the necessity which made me choose this.
Yeah, I really like how you kept on relating it back to, your country of origin, Ethiopia. I mean, I assume like part of you would say that if I had to come back to Ethiopia, this is what they need, and this is what I could, contribute to, which is a good thing to connect to, right? Your home country. Yeah. I'd also say, just to summarize that point you made, I would assume that general practitioners, internal medicine, and the likes are more of like diagnostics, whereas surgeons are those who can actually do something. They have the actual skill. It's more of like a craft, being crafted and being skilled on how to manipulate. Is that a good way of differentiating the two?
I think you're right. Yeah, you described it well. Yeah.
Perfect. Yeah. Okay. I guess now, can you just explain your journey in becoming a doctor? So you've talked about your, the passion you had and what motivated you and how it came out, but you've mentioned kind of, at least for me, a little bizarre pathway, how you were initially, in high school there in Ethiopia, and then you got a scholarship to go to Ukraine, former Soviet Union, and I believe you said you came back, and then after that you worked there, and you got another, offer to come to Canada, and then you got another degree there, slightly different, like that journey. Because the reason I'm asking is I've seen a lot of youth, and even personally me, like, when you try to plan out your future, it never is straight line. It's something, and then you have to retrace back. And one of the things that I would hope if you can also elaborate on is you've done part of your medical school, but then after you came back to Canada, some of it wasn't allowed, so you had to retake exams and the like. So you had to redo something, and I assume that would be frustrating to others too, right? Like, I already studied this many years. Why am I gonna have to make up another and then study more after? So if you could just describe that journey that you went through, and the challenges and the struggles that you went through, and what made you persevere through that.
Good question. So, one thing that helped me through this, of course, as you already described, it's not an easy journey. It has a lot of its own challenges, but first of all, patience, persistency, and then also love for what you are doing. If you don't love it, don't do it. That means because down the road, even after you get into the system, there will be so much challenges. And when you go to start to work, then you will start to ask yourself, why I suffered that all? So you have to have the love of what you are doing, and you have to realize that it's something that gives you some enjoyment, because first of all, going through all the exams and the preparation and getting in a system by itself was not easy task, because the system is specifically and aimfully trying to protect only the Canadian schools. They don't want to be overwhelmed by those who are coming from outside, unless there is the necessity, and that by itself is a big challenge. just to give you an example, I don't know, I don't want to take too much of your time, but I think it is important that, the younger generation like yourself, so that I have an idea. I was studying, Sunday to Sunday, let me put it that way. I was spending maybe 12 hours a day to get into the system and preparing for that, and within 2 years. And that by itself will tell you how much of competition it is. You have to be ready for that. And you need to suppress other needs that you have, and know that you are sacrificing your time. And you may sacrifice, having extra time for your friends and families, which, you have to carefully think about it, whether you can do that or not. Once you are getting into the system, especially when it comes to specifically to surgical residencies, you have to know that you will spend a lot of time in a hospital, will be a lot on call. And at those times will be very challenging. And if you ask me, as you get older, also those challenges are different, because you start already living life to some degree. Now you have to go back to, doing the things that you were supposed to do when you were youth. That will be challenging. Again, just to address, maybe we'll come to it. I don't know if you will ask me later or not about this, for Canadian graduates who wants to do this, interested on going into medical school. The preparation starts from the high school, but we can talk about those in detail later if you.
No, I think that would be a good point right now, just explaining that. I guess quickly, if you could explain specifically your challenges in getting I believe you had to redo the MD, or part of the MD, correct? The clerkship, and right before that. If you just explain what you had to do to study. Did you fail in that sense? Did you, let's say, write an MCAT test and fail and then had to do it again? Or did you apply for admissions for the first year and fail and had to do the second one? Just any failures you came across, if you could just explain within that year of getting into it, because I believe that's the hardest part. Many people say after you get in, it's a matter of perseverance and it's a passion and the likes, but the real challenge is right before that, right?
Okay, so for me, as I say, it's a little bit different, because when they had the program at that time, they started a little bit of a window period where they start to take, because of the physician shortage, I would say. In Ontario, started the program called International Medical Graduate Program. But still, I have to take medical school examinations, Canadian exams. There it has part 1 and part 2. The one is just the theoretical part, and the second part is also practical part of it. You have to prepare as if you went through Canadian medical school program, and you have passing these exams are not, a big deal. But again, because you are comparing now to get into this, with others who are preparing like yourself to get into that system. And then once you get into pass those exams and get into clerkship, you have mostly those practice and most of it, and that part is also not a big deal. But by the time you do that, when you start to apply for residency, that's the final part of it. First of all, your age will not stay stagnant at that point. That's the things they look for. They look on your performance, and also whether they like you during interview or not, and other social things that will determine your success. So for me, things were in those parts worked very well, but the failing is actually not the worst part of your problem. If you fail, you'll just learn from your weakness and strengthen yourself and come back again. Again, I'm mentioning my age because at the time when I was doing these exams, probably I'm already maybe at least 5 to 10 years older than the average medical school students. Age should not be a determining factor. In a sense, if you fail once, it doesn't mean that's it, end of the world. No. Look, I already started residency in Black Lion Hospital in Ethiopia, first year. But I came here, I did exams that the medical students are doing it. I passed that, but again, I did 1 year of medical school, the clerkship program. If I say, I already did all this, why I have to go through all this suffering? I wouldn't be where I am. You have to always look what your, what you want to achieve, what your end goal will be. Especially on this, probably it works for other professions also. And for medical school, failing is by itself doesn't mean you don't know anything. First of all, if you are aiming there already, you have to know that you are competent enough to go. You are just competing with the people and you need, to somehow make your success, the success to work for you. Let me put it that way. Just to give you an example, in my case, there may be a bit of luck also involved, but I know people who were applying even in 100 medical schools, including US and Canada, in hope that they'll be called or will be successful in one of medical schools. That's how you think, and broadly. You don't put your eggs on one basket. You mentioned the MCAT part. That is, the first part of preparation. This will prepare you for, the theoretical part of it, and maybe to get you knowledge-wise ready to get into the system. Knowledge alone will not determine your success. So they are looking on what kind of services you did volunteering. They look at it, what you'll bring to the school different that make you, to be chosen. For example, are you active on sport or physical activity? Are you active in your community? Are you doing something for your community? Are you passionate about something? It doesn't matter. You could be traveling a lot, or they want to see all those. They want to see your personality. And again, there are also some social factors that will make it your success also challenging, maybe, which shouldn't be a burden, but you have to take into consideration and strengthen these social parts that will negatively impact you, to strengthen them with the other things such as volunteer, working for your community, being active on one thing. But if you are not successful in 1 year, remember, you learn something from this year and it will increase your chance of being successful the next year. That's how you have to see it.
Perfect. Yeah, that's actually well said. I guess I just have one specific question, because you mentioned a point previously that the Canadian system really hard to get in, and they want to keep it amongst the Canadians themselves. Just out of curiosity, quick, if you can quickly respond, is there a difference between the American medical system versus Canadian medical system? And if you're an American, if you're a Canadian, should you also consider applying to American? Because I've heard that Americans are more open internationally than, and the Canadian is much harder to get it, more closed. Can you just elaborate on that, Canada versus America just in medical?
Okay. So in terms of, the system, they are similar. Canadian and US systems are similar. You go through the same system. First year, you get your first degree, then you apply for medical school. The same thing in US. It doesn't matter in what kind of things you get your first degree. You can get your first degree in music and still could be applied to medical school. Back home, they were using a British system, and from get to go, you apply for medical school. It's a 6 years program, but here it's different. Just to, aside from that, when it comes to Canadian and US system, I think all dependent on the need for physicians and the support they have. Canadians we are 37 million. The US has 10 times more population. It is much easier to get into the US medical school systems than Canadian medical school. That's where you have to broaden your your chances by applying everywhere. Because in terms of when it comes to getting prepared for medical school is pretty much similar for the US and Canadian system. The final choice is probably, when you start to work, some people prefer Canadian system to work in. Some prefer the US because, if you are interested in getting more paid, you go to the US. But at the same time, if you don't want too much of litigation, just work and do your best and be passionate about what you are doing, help your people, then you prefer Canadian system. I hope I answered your question. Not sure.
Yeah, that was a brilliant answer. Explain the difference, pros and cons of each, and how it's think through. I guess those are great advices. Do you have any other advice to give to youth? And it can be a general advice, not necessarily for become a medical doctor. Any advice you have for them? Any tips and tricks for Harari youths?
One thing I can say is, maybe I'll give an example of my own, and that way, maybe easy for others to understand where I'm coming from. If you asked me, let's say 5 years ago, what I want my daughter to do or my son to do was, of course, medical school. Because, you always, you get into the system, you don't worry about not being unemployed once you get into medical school. But things has changed with the technology, everything has changed. Now, no profession is safe, but even though still healthcare is the best, with the things dramatically change, even the universities are not, changing themselves fast enough with the changing environment. So now, what I tell my kids is that do anything that you like, do anything that you are passionate about, because you will never give up if you do something you are passionate about. But most of all, what I say to our youth is we need to understand, the social part of the challenge that we have more than the others. That should not be a barrier. Yes, we have to work a little harder. yes, the doors may not get open for us everywhere we go, but we need to knock on those doors and be able to go in. How we do that? By being involved, socially, and know what we want requires from us to get ourselves in a best position. And most of all, not getting what you want at once is never a failure. It's a lesson. Never give up. I can't tell you how I want to stress on that. Never give up. Tomorrow is another day. Tomorrow is another opportunity. It's okay when you are a teenager at school or even after you graduate, if you don't know what you want, but do something. While in a process of going to school, you will find what you want.
That's a great advice over there. And I like how you said, do something that you're passionate about, but at the same time, once you have that, don't let the fact that it's very hard for me to do it or is very challenging for me to stop you, right? So if you want to become a medical doctor, then don't say, oh, but it's too challenging, so I'm going to do something else. No, continue trying through and going forward. That's actually a great point there. You also mentioned a point. I think a lot of people would have questions on this, or like would want to know more about that. So briefly, if you can go, which is about the jobs you said in general, how everything is becoming less rigid, and I would say because of the advancements of robotics, automation, AI. I guess my specific point would be, so I have actually a degree in biomedical engineering. So I studied about robotical surgery, the idea about using robotics for surgery. You can either bridge on that point, or you can respond in general. But do we see that, for example, surgeons being replaced by these, or for a large portion of surgeries being replaced by robotic surgeries, let's say, in that specific sense, or in the general sense? Now there is, AI conversation bots that maybe people can communicate with, and it gives them diagnosis, right? Or one of them is like medical imaging, where AI will automatically, or artificial intelligence would just analyze your X-ray or your CT or whatever. If you can answer in that, or in general, what do you think is the new thing that's over, like, what would be the best to focus on in any of the fields in terms of technology? How is technology overlaying, especially in medical, or you can answer in general?
Good question. Probably the example you gave is a good one too, because something that I can for sure see where it's going, and I can talk about. But in general terms, if first of all, we need to know our personality. Are we a kind of person who are more a social kind of person, or a kind of person who are interested in technology and pursue and work in this area? Once we figured out what we want, then it will be easier. Yes, the technology is disrupting everywhere. Medicine is not safe. As you said, in the future, the job of the doctors is, also just like in anyone, for example, a lawyer or accountant, or this will maybe AI will take over most of the work, or even make them out of job. The same thing will happen, that we may not, the doctors, you may not have to go to the doctors like before to have your diagnosis, and you have, choice of treatment. But when it comes to robotic surgeries, because this is the skill and the technique that requires, at least at this point, the human involvement, let's say for the next maybe 10, 20 years, I don't know, this may get faster, or even maybe 50 years, still it requires the human involvement. the robotic part may make your surgery more precise, more accurate, more helpful. You don't have to break your back. You can sit on your table and do the surgeries with your fingers and those things. But still, it requires the human input there. But let's say, in terms of, let's say we are talking about the cancer surgery, this AI may delineate and may show you or tell you where exactly you need to do your cuts and where, in terms of a better outcome for the patient, not to leave a cancer cells behind or something like that. It will improve the quality. It will make your life easier, but it will not replace you completely. That it may, minimize the amount of people who will go into that field, but it will not replace completely. That's where the problem is. Nobody can tell with the confidence how fast the AI is changing things. That's the challenge. That's why you have to know, first of all, what kind of person you are, and try to figure out what you are passionate about, and then decide. And that after all, after, going through all this, eventually you want to have work, support your family, and have a reasonable, decent life.
Yeah, that was really a great point over there. I guess for the audience, just to add, if you don't understand AI, or also known as artificial intelligence, it's basically having computer learn some things and be able to predict better and use that knowledge. So it's trying to basically use our, in a sense, is putting cognitive abilities on a computer. So that's it's really an emerging field, and it's something I've always looked up to. So yeah, as even Dr. Amir mentioned, it's creeping into even the medical field. So these are just a few emerging fields, and something to give a look into in relation also to medical school and its applications. It was a pleasure having you, Dr. Amir. Do you have any final questions, any final thoughts like that you like to say?
Not really a lot, but one thing I would say is, again and again, know who you are, do what you like, never give up. And, finally, thank you for the invitation. Thank you for giving me this opportunity.
Yeah, it's great to have you, honestly. It's really us, and I assume all the Hararis are happy that you're giving your experience so that they can also look up to you and also learn from the journey you've provided, and hopefully it'll be an inspiration for the youth to come. Thank you everyone for watching. We hope you enjoyed it, and with that, inshallah, assalamu alaikum wa rahmatullahi wa barakatuh.